Hello everyone, my name is Dr. Habeeb. I am working in Abeer Medical Center, Abu Hamur, Doha, Qatar. I am a specialist in internal medicine, and so I will be discussing you with regards to the most common disease which is prevalent in the GCC countries, that is diabetes mellitus. Now, a lot of you will be having a lot of questions regarding diabetes mellitus. So, we will move forward with the diagnosis, the treatment, the causes regarding this disease. So now we move on to the classification of diabetes mellitus. That is, there is three types. One is the type 1 diabetes mellitus, type 2 diabetes mellitus, and the gestational diabetes mellitus, which happens during pregnancy. Now, in detail, when we talk about type 1 diabetes mellitus, this is usually seen in the younger age group. That is, it is seen from the age, very young age, from childhood. Now, type 2 diabetes mellitus, which is the most common, most prevalent one which is seen, it affects in all age groups. Now, we'll talk about how diabetes affects the body, or how the mechanism of action, what happens when diabetes affects your body. So, there are two main reasons which is commonly seen. One is the insulin production from the pancreas is less or it is damaged. And the second type is when the insulin which is produced by the pancreas cannot be effectively used by our body cells. Now we will talk about the symptoms of diabetes, which is most commonly seen. That is, the most common one is loss of weight. When the patient or somebody who loses weight inappropriately, you would think about diabetes as the first concern. Then the second one is excessive thirst or excessive eating habits. That is, you feel to eat more and more, you are always hungry. And the next one is when there is chronic infections. You have an infection in your body and it does not heal. The most common question which is encountered in our field is, can diabetes be cured? So at present, as of now, there is no cure for diabetes mellitus. The only thing which we can do is something called reversal of diabetes. That is, with a good lifestyle modification and a proper diet, you can stop the medicines or you can continue in this format. The most common causes of diabetes mellitus is lifestyle or lifestyle management. Now this includes obesity, physical inactivity, your lack of exercise, diet, and ethnicity as well plays an important role. And finally, the genetic factor. Now, when we talk about physical exercise, lack of activity, you have to make changes in your lifestyle or modification has to be done. This includes even your sleep and waking patterns. If you get too much of stress, all these conditions will start affecting the blood sugar levels in your body. Now, what happens when there is a lot of stress or when you have lack of sleep? These things will increase your glucose production in the body, and the insulin cannot systemically digest the sugars. Now, how do you diagnose diabetes mellitus? Now, there are physical conditions which the patient present to us, like increased intake of water, increased food intake, lack of energy, lack of sleep, and repeated body infections. So together with this, we ask them to do blood analysis or blood investigations to find out the exact values. So to conclude my talk on diabetes mellitus, the most common or the most encountered question is, what is the basic thing which we can do to control diabetes? That is always the answer is lifestyle modification with diet and exercise. Then comes drugs and insulin and all the other further management. So in order to stay away from diabetes mellitus, always maintain a very healthy lifestyle and a good diet practices. Thank you everybody for attending the talk. So getting diagnosed with diabetes mellitus is not the end of life. Change your lifestyle, eat healthy and stay healthy. Thank you.